Hi, I'm Kevin Harrington, an original shark from the hit TV show Shark Tank. And with me is Dr. Matt Gianforte. Dr. Matt, how you doing? Thanks for being here. Now, you're with LifeWorks Integrative Health, and you're in Shawnee, Kansas. You've been doing this 15 years. The integrative side now about the last 5 to 7 years, correct?
5 to 7 years or so we've been doing the integrative model.
What got you into this business?
Well, really trying to find solutions for myself, being an athlete.
Oh, really? Okay.
Having injuries of my own. I was running into challenges, and it kept being little joints hurting here and there, and I had to find solutions for myself, but I knew when I was finding those solutions that we were able to tie it back in with our patients, and it just, everything kind of snowballed from there.
What sports did you play?
I ran track in college, played football in high school, and basketball and so forth.
There you go.
Just always injuring myself, sprained ankles, torn up knees, busted hands.
And sometimes those things will come back then years later. Like I wrestled and basketball and football, the same thing, and I've got some old things coming back now. So this is an industry that's exploding. You're in on the ground floor. You've been doing this totally now 15 years, the integrative side 5 to 7. But where do you see this industry going? You're in at the right time. It sounds pretty exciting.
Right. I really feel like this is the beginning of it, because we're in an epidemic right now, and as we know, there's more people today that have joint pain than ever before. We've got 86% of 50-year-olds having arthritis, 96% of 80-year-olds having arthritis. So it's not going to get any better. And our approach that we've had today with arthritis is, if you have pain, well, then you do something about it, right? Well, it's just the wrong approach, because so many other degenerative diseases today, they look at, say, blood pressure for heart disease, or they'll look at other blood markers for diabetes. But we've used pain as the indicator for arthritis, and many times that's too late, or it's already progressed.
Oh, I gotcha. So in the world of integrative medicine, do you have a particular niche in that area that you specialize in, that you like to focus on?
Yeah, so we do a lot with osteoarthritis, joint pain, as well as people that suffer with neuropathy. So really pain across the board is where we have really specialized in helping people get to the root cause of the problem and really doing the tests to predict what's happening in the future, right? And so are they more predisposed for arthritis or wear and tear on a joint? Or is it something that we can stop before we have to get into really some serious treatments?
Right. So now, over the years, you've I'm sure worked with hundreds, if not thousands, of folks.
Oh yeah.
You got any that are coming off the top of your head where you've had some amazing results with?
Yeah. So we had a gal. Her name was Karen, that came into our office. She was early 60s probably.
Yeah.
And her and her husband come in, and they're talking about how they're getting ready to put their house on the market, because she couldn't walk up the stairs anymore.
Oh, wow.
And so she came in, we started taking care of her. We not only corrected the biomechanics of her joints, but then we used regenerative medicine to help to regenerate that tissue. Well, now she's back in the house. They don't have to sell it, and they're able to stay there. So.
Wow, that's pretty amazing. So you mentioned, when I said, why'd you get into the business, it was for your own needs, and now you've solved some of your own problems. Now you're solving many other people's problems. Pretty fulfilling business to be in, isn't it?
Oh, absolutely. When you can take somebody that can hardly walk, they're using a cane to get around, they can't get up the stairs, they're not enjoying their life with their family and their friends, and then they're able to do these again. Yeah, absolutely. Very rewarding. That's why we love doing this every day in our office, really helping people get to the root cause of the problem.
Right. So now, for anyone that's out there, we're putting some information up on how they can get a hold of you. It's right there on the screen. But I just wanted, do you have any last words of wisdom to folks that they're not real sure what to do? I mean, like, I know people that the question they might have is, when should I go? And so what kind of words of wisdom do you have for anyone out there, is when they should contact you, or what's the best way to go about that?
So one, anytime you have some sort of discomfort, pain in a joint, always get it corrected and get it checked right in the beginning, right?
Okay.
But we can also begin to be proactive with this, because with certain measurement tests that we can do with joints and movement tests, we can actually predict what's going to be happening. So if you know, like, you've got a history of joint pain, then come on in, let's get it evaluated, let's test some of the movements that are actually happening within the joints to be more proactive rather than reactive with the
Gotcha,
joint.
almost
Right?
preventative type of thing.
Absolutely.
Right? Yeah, that's fantastic.
Yeah.
All right. Well, listen, Dr. Matt Gianforte, it's great having you here today. LifeWorks Integrative Health.
Thanks,
and
Kevin.